Hello. Today we're going to present to you about delayed hypersensitivity. Before we start, I want to introduce you to my fellow nurses.
Meet our dedicated team members. First one, Nur Saidatul Husna binti Nani. The metric number is 2025483164. Nur Atira binti Zaini. The metric number is 2025228314. The last one is Siti Nur Nabila binti Azman. Metric number is 2025479892. Today, we're going to explain about the meaning of delay hypersensitivity, timing region and mechanisms, signs and symptoms, functions, example, and how we can prevent and treat the disease.
What is delay hypersensitivity? Delay hypersensitivity is known as type 4 hypersensitivity. There is an immune response that takes 24 to 72 hours to develop after exposure to an antigen that involves mediated by T cells, not antibodies. It is called delay because it occurs much later than immediate allergic reaction like hive or anaphylaxis. It involves T cells activating other immune cells like macrophage, which then cause an inflammatory reaction in the body. Examples include the reaction to poison ivy and the positive result of the tuberculin skin test.
Timing reaction for delayed hypersensitivity, which also known as type 4, typically it happens for 48 to 72 after exposure to the antigen. The time frame is when onset. The symptoms usually begin to appear between 12 to 72 hours after antigen exposure. For maximum reaction, it often peaks between 48 to 72 hours. Next is the mechanism. Sensitization phase, also known as initial phase, is where the immune system must first be sensitized to the antigen, which usually happens upon an initial exposure. Next is effector phase, also known as re-exposure reaction. It is upon subsequent exposure, antigen-presenting cells process the antigen and present it to previously sensitized T lymphocytes. Next is signs and symptoms. First is redness, which is erythema. It is a cardinal sign of inflammation caused by bacteria and it is an allergic reaction. Second is swelling, which is edema. It is a disease where fluid retention or dropsy caused by an excessive amount of fluid trapped in the body's tissue. The last one is itching, which is pruritus. It is an irritating sensation that makes a person want to scratch, which unfortunately releases inflammatory mediators that can temporarily increase the sensation of itch, leading to a difficult to break cycle.
Next, what is function of delay hypersensitivity? Delay hypersensitivity functions as a T-cell mediated immune response essential for defending against intracellular pathogens like mycobacteria and fungi, and also play a role in transplant rejections and tumor immunity.
Now, let's look at the example of type 4 hypersensitivity. First one is contact dermatitis, when skin reacts to something you are allergic to. For example, hair dyes, shampoos, cosmetic products, shoe materials, metal in jewelry, soap, detergent, fragrance or perfumes. Second example is granulomatous type hypersensitivity. It happens when the immune system reacts strongly to something and forms granulomas, which are small clusters of immune cells. The body's immune system becomes overreactive and forms granulomas in different organs. The common type of reaction are sarcoidosis and tuberculosis, TB. And lastly is fixed drug eruption, or known as FDE. FDE is a skin reaction caused by a drug. Usually appears as a single, round, or oval dark red patch on areas like lips, genitals, around the anus, hands, or feet. The rash often appears within 8 hours after taking the drug. However, in some cases, it may take up to 2 weeks. If the person takes the same drug again, the rash usually comes back in the same spot. After it heals, it often leaves a dark mark on the skin, called hyperpigmentation. How to prevent type 4 hypersensitivity? By avoiding triggering agents, for instance, avoid wearing nickel jewelry, use fragrance-free products, avoid latex gloves. Second, wearing gloves or protective clothing helps prevent direct skin contact with allergens. The last one is avoid causative drugs permanently, such as antibiotic, by not taking again. What if you still get exposed to the allergen? In that case, you will need treatment by going to the hospital for severe reactions. Next is using moisturizer to soothe the skin. And lastly, treatment may include systemic glucocorticoid therapy to reduce inflammation.